Hi, my name is Jennifer Rosado, and I would like to perform an assessment on you today. Do I have consent to do an assessment?
You most certainly do.
Awesome. So I'm going to perform hygiene. Can you confirm your first and last name?
Eddie Brandon Rosado.
Date of birth?
8998.
Awesome. So first assessment I'm going to do is of your abdominal. And if you could lay down. Thank you. So we are removing the patient's shirt, and I am looking at the contour. I'm looking for peristalsis. I'm looking for massage, striae, any abnormalities. And I can see that the patient's abdomen is round, it is soft, symmetrical. I don't see any abnormal findings at this time. So next I'm going to listen to each quadrant for bowel sounds. So I'm going to start at the right lower quadrant and work my way around, listening for 1 minute on each quadrant. And I do hear bowel sounds in every quadrant, and it is normal active. Next, I'm going to percuss the abdomen. And the abdomen was tympanic with some scattered dullness. Next, I'm going to palpate your abdomen, starting with a light palpation. Let me know if this is painful for you.
Nope.
Great. So the patient did not report any pain, and it was soft and non-tender. I didn't notice any rebound, tenderness, or rigidity. So next I'm going to do a deep palpation. Again, please let me know if you experience any pain. Any pain?
No pain.
All right, great. So now I'm going to assess for liver span. Starting at the midclavicular line, going to percuss down. And then I'm going to do the same, starting at the bottom half now. So the liver span is 6 to 12 centimeters, which is an expected finding for an adult male patient. And next I'm going to assess the spleen. So I'm going to place my left hand under the left costal margin and instruct the patient to take a deep breath as I palpate down. Please take a deep breath. Let the breath out. All right. And I do not feel splenomegaly. In an adult patient, you should not feel the spleen, so this is a normal finding. Next, I'm going to listen for vascular bruits. I'm going to start at the aortic. And then I'm going to listen bilaterally now, moving over to the renal arteries.
Vascular bruit.
And then I'm going to locate the belly button, and I'm going to now listen for the iliac bruits symmetrically. And then I'm going to listen for femoral. I did not appreciate any bruits, which is a normal finding as well. Next, I'm going to assess for the patient's aortic pulse, and I'm going to locate the belly button, place my hand midline, and feel for the pulsation, which is midline and at normal amplitude. Next, I'm going to have you swing your legs across the bed. And I'm going to assess, and please stand up. Sorry about that. I'm going to assess for CVA tenderness. Any pain?
No.
Any pain?
No.
Next, we're going to check for rebound tenderness or rigidity. Any pain?
No.
Excellent. All right, so that concludes our abdominal exam. You can have a seat and we can move over to the neurological exam. Can you tell me what year we're in?
2025.
And do you know where you are right now?
I am on the island of Martha's Vineyard in Massachusetts.
And do you know your name?
Eddie Brandon Rosado.
Great. So patient is alert and oriented to self, time, and place. Next, I want to test for cognitive function. Please count, starting at 100, subtract 7 twice, please. So starting at 100, subtract 7.
93
Yes.
and 86.
Perfect. Thank you. Next, we're going to test for higher intellectual function. Can you tell me what you would do if you would find someone's wallet on the floor?
First thing I would do if I found someone's wallet is look for the ID, see if I can identify and locate the person, and if I cannot do that, I will drop it off at the police station and post online wherever I can to let people know that it's been dropped off.
Excellent. And next, I am going to test for your cerebellum function. And if you could put your hands out, we're going to start with sensation. Can you feel this? In your toes, can you feel that?
Full sensation.
Great, sensation is intact. Next, I'm going to have you touch my finger and then your nose. Do it faster. Great. So patient's coordination is intact and he can perform rapid alternating movements. Next, I'm going to have you stand up and walk from there to here normally. Great. And now turn around and do heel to toe, please. Great. Gait and balance is intact and steady. So now you can have a seat and we're going to test for your cranial nerves. Starting with the first one, olfactory. Please close your nose. Can you tell me what you smell?
Vanilla.
Perfect. Well, cranial nerve 1 is intact. Now we're going to test for cranial nerve 2, which is visual acuity and peripheral fields. So by doing that, I'm going to have you hold the Snellen visual graph, and you're going to stand 20 feet from me, and you're going to read from a line. And so I'm holding it. Can you please read from this line? Just across.
Yeah, the cat is inside the hat.
No, it's just alphabet, like just
Oh, A, B, C, D, E, F, G.
Great. So patient has 20/20 vision. Next, we're going to test for visual fields, and I'm going to have you please cover your right eye. I'm going to cover the same eye. I'm going to hold a number up, and I want you to tell me what number it is. So I'm going to start up here. And can you tell me what number I'm holding up?
3, 2.
Great. Now let's cover the side. We're going to do the same thing.
3, 2.
Excellent. Now you can put your hands down. Thank you. So now we're going to test for cranial nerve 3. And I have a pen light. I'm going to have you look straight at the wall.
Oh my goodness.
And I'm going to shine. I'm going to shine light into the pupils. And I want to see them constricting bilaterally. So,
Okay. Laterally.
okay. And so we're doing this on this side. Now this side. And now we're going to check. And I see that the pupils constricted bilaterally. And now we're going to check for accommodation. So I am bringing the pen light in, and I can see that the eyes are constricting bilaterally, and also converging. So now we're going to test for cranial nerves 4, and 6. And I'm going to have you follow my pen light, and we're testing all the 6 cardinal gaze of field. So starting up here, just follow the light.
Police.
Awesome. Great. Next, we're going to test for cranial nerve 5, trigeminal, and I'm feeling for the masseter muscle, temporal muscle, and can you try opening your mouth against my hand? Great. And can you clench down? Great. Now please close your eyes. Can you feel this?
Yes.
And this?
Yeah. Yes.
All right, great. So next we're going to test for cranial nerve 7. Can you please smile? Puff your face. Frown. Perfect. Cranial nerve 7 is intact. Next I'm going to test for cranial nerve 8, auditory. So I am going to cover this patient's ear and I'm going to whisper. Let me know if you hear it.
Yeah, I hear that.
Can you please repeat it?
Cat, dog, cat, dog.
Apple, banana.
Apple, banana.
Awesome. Cranial nerve 8 is intact. Next we're going to test for cranial nerve 9 and 10. And I have a tongue blade. Can you please open your mouth? So I am looking, say ah. Great. So I'm looking for the uvula to move upwards, which it did. And next we're going to test for the patient's gag reflex. Great. Patient gag reflex is intact. And next and I can see that the patient can swallow and there's no hoarseness in his voice. And now we're going to test for cranial nerve 11, which is the accessory muscles. Can you please move your shoulder up? Great. Perfect. And lastly, we are going to check for cranial nerve 12, hypoglossal. Can you please stick out your tongue? Stick out. Great. And I can see that the tongue is midline. Excellent. Thank you. So now we are going to move on to the patient's reflexes. And I'm going to use this hammer to test for the bicep reflexes, and then so I would hit the hammer here, tricep, and then the radial ulnar, and I would do it bilaterally, and I would expect to see a 2+ reflexes symmetrically. And then I would also do the hammer reflex, you can put this down, on the lower extremities, which would include the patellar. I would hit it there. We would see the foot move up. Great. And then Achilles. So I would have the patient have their foot dorsiflexed, and I would hit the hammer behind. The foot should move. And then we are also going to test for Babinski. So I'm going to grab the foot and move my finger across like this. And we should just see the toes curl. And then there is clonus, which doesn't really apply to this patient, but if we were to test the clonus, you would grab the feet and you would push it back and in that movement, and you would see if there was any pulsations going down. So this patient is negative for clonus. And now we are going to test for the musculoskeletal. So first, if you don't mind standing up, I am looking at the patient's spine. The patient does not have a shirt on at this time. So I'm looking at the patient's spine and I'm feeling for C1 and C2, which is intact.
You want me to take my shirt off?
No, it's okay. Thank you, patient. We are assuming that you do not have a shirt on. And we are looking down and palpating the spine, feeling for any misalignment, which isn't the case. I don't feel any masses, no crepitus. And I would be also looking for any curvature like scoliosis. I would be looking for humpback, which is kyphosis, or lordosis, which would be a irregular format at the lower back. So now I can see, now that I've examined and palpated the neck and the spine, I am going to test for the range of motion. So please look down. Now look up. Now look to the left, the right, and touch your ears to your shoulder. Perfect. All right, so patient has full range of movement in the neck. I'm going to place my hand here, and I want you to apply force against it. Perfect. Now same side. All right, and patient has full strength in his neck. Next, we're going to move to the shoulders. So I'm looking for symmetry. I'm feeling the joints, and I'm examining the clavicle. I'm feeling the AC joint, and I'm looking for any signs of crepitus, any abnormalities. I don't see it. I'm looking here at the scapula, which feels normal, and it's symmetrical as well. So now I'm going to have you place your hands out and place your hands back. Place your hands up. Great. And then I'm going to have you open up your hands. Now put it down, please. Now reach behind your head. Great. Now reach behind your back. Ooh. Excellent. Great. And patient has full range of movement and motion in the shoulders. Seems like you had a little pop there. So excellent. Now I'm going to test for your strength. So shrug up against my hand. Perfect. Patient has full strength in the shoulders. Next, I'm going to look at the patient's arms. I am looking at the elbows, the wrists. I'm feeling the joints, again, for any crepitus, any abnormalities. The joints are aligned. I don't see any discoloration at the joints. And so let's test for the range of movements in your wrists, or I'm sorry, your elbows. So please place your hand out. Now flex it in. Great. And put your arm out. Pause, yep, and then up.
Pause.
Hand, sorry. Up. Perfect. Now I'm going to apply force. Great. Same thing. Great. All right, so now I'm looking at the wrist. I don't see abnormalities in these joints. Can you please point your hand up, your wrist up? Now down. Great. And now I want you to place it up, place it down, and while you're here, open up your hands and do this. We're checking for radial ulnar deviation. Do this. All right. And now let's look at your fingers. So there's a lot of bones in the hands. You want to feel for any deformities, any crepitus, any misalignment. And can you open up your fingers? Both hands, please. Can you close them? Can you point them down? Can you point them up? All right, and can you now squeeze my hand? All right, full strength there. Excellent. So now we're going to move down to the hips. I am looking at that the hips are symmetrical. I am feeling for the hip joint. Any pain, discomfort with that?
Nope.
Everything looks aligned. And I'm going to have you kick your feet up. Now back. Now to the side. That way. If you stand like this. Yep, okay. Great, now bring it in. It's the abductor and adductor. Now I want you to lay down for me, please. All right, so I'm going to grab this leg and I'm just going to bend it. Okay. And now I'm going to that way. Any pain?
No pain.
And then we're going to do it that way.
No pain.
All right. And now move your foot, try to move your foot in against my resistance. Great. And do it up. Great. And we repeated that on this side, the other side as well. Same findings, which are normal findings, full range of motion, and full strength. Now we're going to move to the knees, and so you can actually swing your legs across, please, and just have a seat. So can you, so I'm first looking at the knees, the patellar. I'm looking for any discoloration, any warmth, any misalignment. I see that everything is within normal findings. It is aligned, symmetric. There's no swelling, no warmth. Any pain when I palpate? I don't feel any crepitus either. Can you please extend your knees out? Great, and then can you pull them back? I think I might have you stand up. I just want to see you bend your knees, please. All right, now pull it up. Now up. Okay, great. And apply force against me. All right, you can have a seat one more time. And now I'm going to look at the patient's ankles. Again, I'm assessing both of these joints. I'm looking for any discoloration, any swelling, any crepitus. So I don't have any abnormal findings. And can you please flex your feet up? Great. Now press on the gas pedal. Great. Can you move it to the side? Circle, please. Great. Now I'm going to test for the strength. Go against my hand. Great. Now down. Great. And we repeated that on the other foot, and we found the same assessment, full range of motion and full strength. And this applies to every joint that we have done. And let me just see here. I believe that we have covered all of the areas of today's assessment. I appreciate your willingness to be my patient today, and thank you for watching.